Transparent Health, keeping patients safe. Training levels of caregivers. This short film will provide information you should know regarding the different training levels of healthcare providers that may be involved in your care during your hospital stay. Other than your personal physician, most staff will be at various stages of training, including medical students, residents, fellows, hospitalists, and consultant physicians, as well as trainees in other disciplines, including nurses and nursing assistants. It is important for you to understand who you are talking to, what their title is, where they are in their training, and what role they play in your care.
We thought it was crazy, but we didn't know how to get out. We didn't know how to get help. We didn't know how to get in touch with anyone. I had no idea who, if anyone, the nurse answered to. I had no idea how to go above her head, which I certainly would have done. All I knew to do was to ask for a higher level physician, which I did persistently.
One thing that is good for the public to know is that in healthcare, there's what I call different tribes. There's the doctor tribe, there's the nurse tribe, and other healthcare professionals who have their own tribe, whether it's pharmacists. And within each tribe, there's a pecking order. There's a hierarchy. So among physicians, there are medical students. Then there are residents. Among residents, there's first-year residents who are still learning, very green. Then there's more seasoned residents who are in their fourth year. Then there's senior attending physicians. And a lot of miscommunication can happen up and down these hierarchies and across the different tribes. And it's important for patients and families to know who it is that they're talking to when they're in the hospital setting.
And after a while, I realized there was some connection between my asking for the doctor and this exhausted-looking little intern who would show up an hour or so later. I made it very clear that I wanted an attending physician. I didn't know that term, but I asked for the doctors by name. And I said, I want, the two names that I knew, the doctor who had been on call on Saturday and Lewis's surgeon. I said, I want one of them or I want their partner. I felt sorry for the intern. I wasn't trying to make life hard for her. She was out there standing by the computer. And I went up and tried to explain to her why I felt that I had to go over her head. And I listed all Lewis's symptoms again. And I said that it just doesn't seem right. It's concerning. I want an upper-level doctor.
Well, a lot of the bad things happened over a weekend, which is always a difficult time because even though there is cover, it's not necessarily fully staffed with attendings. They're mostly going to be working from home on call. And although they're available and certainly can come in to deal with problems, they don't know there's a problem if they're not called.
Lewis was a boy of great promise. I don't think anything that I can do in his name will ever approach what he could have done for himself. But we have tried to create a legacy for him. So the Lewis Blackmun Act, which passed the South Carolina legislature in 2005. It requires that all hospital staff be identified as to not only name and title, department, and job status, whether or not they're a student or a resident.
If you are a patient in a teaching hospital, many less experienced doctors and nurses may be making decisions about your care. These include medical students, interns, residents, fellows, nursing students, and nurses' aides. They should be reporting any issues related to your care to your personal physician. know who you are talking to, what their level of training is, and who they report to. If your caregiver is not wearing appropriate identification that clearly states his or her name and level of training, it is appropriate for you to ask them for that information. Remember, if at any time you do not feel that your needs are being met or your questions are not being answered, it is your right to request to see or speak to your personal physician. All hospital staff should honor that request. Transparent Health, keeping patients safe.